Yeah, good morning, everyone. It's my great pleasure to introduce our keynote speaker, Dr. Alejandro Rivas. As many of you know, Dr. Rivas is one of the pioneers in endoscopic ear surgery, but he also has extensive experience in cochlear implantation, including the treatment of single-sided deafness. He's published well over 100 peer-reviewed publications and book chapters. He also recently became a Buckeye. It was really exciting for me in Columbus. As he moved from Vanderbilt University in Nashville to Case Western University in Cleveland, Ohio. Dr. Rivas contributed tremendously to the field and serves as the General Secretary of the AzBio American Cochlear Implant Group. I hope I pronounced this correctly. As a result of his contributions, he has also been inducted as a member of the Collegium Otorhinolaryngologicum, and which is one of the highest honors in our field. Dr. Rivas grew up in Colombia and earned his degree from the Universidad Militar Nueva Granada School of Medicine. Again, I hope my pronunciation was adequate. In his hometown of Bogota. He completed a research fellowship and subsequently his otolaryngology head neck surgery residency at Johns Hopkins University, and subsequently completed his neurology fellowship at Vanderbilt, where he remained for a number of years before again relocating to Cleveland last year. Dr. Rivas is going to speak to us on improving cochlear implant access using a Spanish test battery, and we're delighted that he agreed to talk to us today. Alejandro?
Oliver, thank you so much for this invitation and for the organizing committee for asking me to talk about this. You did great, Oliver. Your pronunciation for this talk was perfect. You just set the tone for what we're going to be discussing. And we're going to be talking about improving CI access with Spanish test battery. These are my disclosures. I'm a consultant for those companies. And we know that Spanish is the second most spoken language in the world today. And the data that I have is from the previous census. I know that there's one census coming up soon, and we're all up in arms about numbers for voting and so on. But I'm more interested in seeing the numbers of Spanish speakers that we are going to be having in the new census. But from the data that I have from the old census, there's over 437 million native Spanish speakers around the world. And in the United States, 41 million people age 5 or older speak Spanish at home. So that's a significant number of patients. It's the second most spoken language in the United States, and is the second largest Spanish speaking population in the world after Mexico. From that, it's very important that we have the appropriate methods of testing patients in Spanish in the United States, in something that is comparable actually to English. So there are multiple tests in children in Spanish. They're in terms of parent questionnaires. We have, for example, Little Ears. It's in Spanish, which is for ages between 0 and 24 months. You have the Eat Maize between 0 and 36. You have Peach, 3 to 7 years old, and that's for questionnaires. Now, if we look, for example, at language evaluation in Spanish, you can find the PPTV and for more than 2.5 years old, the PLS for 0 to 6 years old, and the CDI for 8 to 30 months. And specifically for auditory performance, we have the ESP that can be applied for kids between 3 and 8 years old. Now, that's for children's. Now, what do we have for Spanish? What type of sentence recognition test do we have in Spanish? Well, we used to only have the hint test. And we know from the studies done in English that the hint test has a ceiling effect. There hasn't been publications looking at the ceiling effect, but Sandra Velandia has actually done, from the University of Miami, has done quite a bit of work looking at the hint test and how the effects, the ceiling effects occurs in patients with cochlear implants. And so I asked her to provide me with some cases, and she very gracefully provided me this one. So I wanted to show it just to show how the ceiling effect occurs using the hint test. So this is a 82-year-old male who has a hearing loss diagnosed 30 years ago and has been wearing hearing aids since he was diagnosed. He has a possible history of biotrauma as he was a former diver. He does have some tinnitus and has a family history of hearing loss in his mother. But the good thing about this case is that actually he's bilingual. He's originally a Spanish speaker, but he spends 70 to 80% of the day communicating in English. And so the nice thing about it is that we were able to test, or Sandra was able to test this patient in both English and Spanish. And so here is, for example, his audiogram. You can see that he has a moderate, severe to severe downsloping to profound hearing loss in both ears. When we look at the discrimination, it's 100% in both ears, and the NU6 is 20% on the right and 16 on the left. And so all of these speech perception tests were done in Spanish as well. So here you can see when we test his hearing with his aided audiograms, you can see where he goes up to throughout 40 dB almost throughout, and then he goes down after 2000 hertz in both ears. Now, what's interesting about this is that when Sandra did the hint test in Spanish on this patient, you can see 90%, he gets very high scores, 90% in hinting quiet on the right ear, 90% on the left ear, and 98 in the binaural condition. Even when we put hinting noise at +5 SNR, we can get, he still does pretty good. 86 on the right, 81 on the left, 78 binaural. So it's not until we do a 0 dB SNR when we actually see a drop down using that particular test in the hint test. Now, if we look, for example, at the testing in English, so AzBio in English, you can see that this patient really using AzBio goes down to 8% on the right, 10% on the left, and 11 binaural. That's in quiet. So you can see clearly a big discrepancy to really how he's functioning with an appropriate test. After the patient was implanted, so the patient was implanted based on the AzBio scores that result in English. And what you can see here is that after implantation, he goes from 8% in quiet, AzBio in quiet, all the way down to 55%. And comparing the hint in Spanish in quiet, there really isn't much of a difference. Again, showing and highlighting the ceiling effect of the hint test. So with that in mind, we can say that there are limited measures of sentence recognition in Spanish with multiple talkers speaking at an average conversational rate. And so Renee Gifford and Luz Adriana Rincon in Colombia and Tony Spark and Michael Dorman and myself decided that we needed to replicate some of the studies that Michael and Tony and Renee had done in English. And so doing a similar studies looking at at an AzBio in Spanish. So we developed a Spanish version as the AzBio sentence. And the goals of our study were to get a large number of equivalent lists, quantify the list variability, and limit the ceiling effect in quiet. So what we did is we developed this this test by recording 2,000 sentences, and we took multiple talkers, 2 males and 2 females, and so here I have a recording of the voice of the speaker. So for the females, the fundamental frequency was 204 hertz and 216, and for the males, there were the fundamental frequency was 100 and 110 hertz.
Las uñas sucias siempre crean una mala impresión.
So that's the first male.
Hable acerca de lo que le incomoda cuando esté tranquilo. ¿Por qué
That was the second male.
tenía curiosidad sobre el seguro de vida de su esposo?
The female, the first female.
En el hotel no sirvieron la comida caliente.
And the last female right there. And so with that in mind, the way we instructed the talkers to read the sentence, where one, they needed to use a conversational speaking rate. So it was kind of a normal setup for the listener. They need to speak on a natural speaking style. Do not over enunciate, and do not over articulate. And when we created the sentences, we also wanted to make, one of the things that Renee told me when we created the sentences were, we need to make sure that they're not easy sentences, that is not an obvious sentence, because we wanted to make it a little bit difficult so we don't get that we don't end up getting that sitting effect. The other thing that we actually did was these were all Colombian speaking talkers. And so one of the frequent questions that we get about it is, well, there's a lot of accents and there's a lot of Spanish words that might mean one thing in one country versus another. So we specifically send all the sentences to different countries, like Argentina, like Spain, and Uruguay, and had them reviewed to make sure that the sentence made sense, and that would be something that would be usable in all countries. Then all sentences files were processed through a 5-channel cochlear implants simulation and presented to 5 normal hearing speakers. And so the sentence intelligibility was scored as the average % correct scores from those 5 normal hearing listeners. And from that, our goal ultimately was to create as many lists as possible to follow the clinical and research application without having to repeat lists. And taking that into account, we ended up with 42 lists, each of them with 20 sentences. So that ended up 210 sentences per talker, and the mean score per list was 85%. So here you can see in the open circles, the open circle represent the mean % correct score for an individual sentence within each list. And when presented to 5 normal hearing subjects listening to the vocode sentences, and the horizontal line, which is at 85%, which is what I was discussing before, indicate the mean % correct score for the list of the 20 sentences. So once we created those 42 lists, then we went into the validation studies. And so for that, we took then the 42 lists and presented it to 10 CI recipients who were native Spanish speakers. And the circles represent the individual score for each of the lists in the 10 CI recipients. And what you can see, and obviously the bars represent the average score. And what you can see here is that there's quite a bit of variability between the 10 the 10 CI recipients. The individual scores range from 38 right here as high as 98 over here. And the mean sentence scores range from 73 to 84% correct. And so given the variability, we decided that we needed to normalize the list for comparison. So here, for example, what we did was the circles, the clear circles represent the individual listening list score relative to the mean level of performance. And so positive scores, so above the zero line right here, positive scores indicate better than average performance, and negative values indicate below average's performance. And the horizontal lines, here, 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 for example, the horizontal bars indicate the average normalized score for each list. And our repeated measure analysis of variance showed a significant, non-significant main effect. So what that means is that basically we can consider the 42 lists to be equivalent in difficulty. So that was very important. Lastly, we look at the list variability. And for the list variability, we took individual list scores in quiet, which is, and in noise. So you can see here, the circles are in quiet, the squares are in noise. And we took the mean score for two lists presented to the same listener in the same condition. And so here what you can see is the dashed lines represent the 95% confidence interval for the Spanish AzBio sentence based on binomial distribution model, which was what was used before for the AzBio in quiet. And we got a very similar result compared to the AzBio in quiet. So with that in mind, we basically learned that that we were able to develop and validate. It took us about 2 years to get this done. We were able to get cross-list equivalency, and that was possible. The variability could be characterized as I showed before. And the other thing is that we can never have enough lists. So now we have 42 lists that you have available. So we created the AzBio sentence corpus, and that provides access to evaluate performance in multiple conditions. Also allows us to perform within subject comparisons in English and in Spanish. I want to see some of the work that Sandra Velandia is going to be doing in Miami, looking at the AzBio and compare that to English, and hopefully in states where there's a bigger Spanish population than in Ohio. I think that I'm going to be looking forward to those studies with this corpus, comparing specifically bilingualism on those patients and see if the lists are comparable. We were able to provide an estimate of performance consistent with English versus comparable with the English version AzBio. And this is important. I don't have any conflict of interest with this website. This is where the AzBio corpus is, and you can get it there. I don't get any royalties or anything like that done from this test. And this is where you can get it. So that's where it's available. It affords comparison across language, as I mentioned before, and it may provide access to clinical evaluation for native Spanish speakers who are also proficient in English. So with that, I think that I'm going to open the forum to maybe a couple of questions. I know that we're running behind. We're going to be mindful and trying to get back in track. But I want to acknowledge my co-investigators, Renee Gifford, Michael Dorman, Liz Perkins, who was very instrumental in putting all of this together while I was at Vanderbilt, Jordan Holder, Tony Spar, Leo Litvak, David Kessler, and the group in Colombia who did a lot of the testing, Alejandro Rivas and Luz Adriana Rincon. And certainly Sandra Velandia, who provided me the case study that I presented early, and she's going to be talking more about bilingualism in the afternoon's session. So thank you very much, and I'm open to any questions.
Yeah, thank you, Dr. Rivas. This was extremely informative. Again, we appreciate your time and effort on this. It's a very important subject, obviously. We did receive some questions in the chat. And the first question here is any research on interpreters scoring the test versus an audiologist?
On any research on interpreters?
On interpreters versus audiologists scoring the test. So if the audiologist is not a native speaker, I guess is...
No, we haven't. All of this was done. All of this was done actually with Spanish speaker audiologists.
Okay.
And so it would be that would be certainly something very interesting to look into.
Yeah, certainly the quality interpreters that we see in our clinical practices certainly differs greatly. Another question is, can we expect a pediatric version?
Yes, you can expect a pediatric, a baby in Spanish, but I haven't started working on that, and Renee might and Liz might start working on that in the future.
Very good. Next one. I think they're pretty quick, so we can still catch up on some time here. From a clinical application perspective, how do we accommodate for different dialects in Spanish?
I don't think that you have to accommodate for that, to be very honest. When we created the AzBio, we were very thoughtful about making sure that I wouldn't call them dialects necessarily. We all speak the same Spanish. There might be some words that might mean in slang might mean one thing or the other, but we were very careful that we would not use those words when we created the sentences. And that was part of the reason why before we tested before we did the validation and before we created the actual list, that's why we purposefully sent all of the sentence to different countries and make sure that the sentence was appropriate. Yeah,
that's a very thorough process. Yeah. So last question here. How may non-Spanish speaking clinicians use these tests? I think it ties into the first question we got. So
yeah, I mean, you still have to score them, right? Yeah. And so that means that you at least need to have a basic understanding or a basic ability to understand Spanish.
Right. I think that's all the questions that we received. Again, we'll catch up on some time. Thank you so much, Alejandro. Again, great to see you and great to hear of these efforts. They're very important, and appreciate the ACI providing us with time for this talk. Thank you.
Thank you very much.